It's a really big part of health in terms of the cost of what's happening in the health sector, and we know the increasing spend on health. We've got to be thinking very carefully about how we try and have a sustainable future. So it goes down to very simple things, I think, when we think about even just waste management in a hospital system. And we do introduce those concepts to our students very early on in their first year of the program, but almost to that bigger picture of how do we sustain our communities to stay in their homes, for example, so we're not having to build major hospitals and major facilities, but trying to sustain our community in a really positive way that is very health promoting as well. So a very complex waste system in a hospital. And our role, I think, as health professionals is to respect that and not be careless in how we manage waste. And so we do have, for example, in our labs downstairs, our clinical laboratories where students do a lot of their preparation for practice, we have different coloured bags as well. So we have ones that say yellow contaminated waste, and that's what you'll find in the hospital setting. In our third year of the Bachelor of Nursing, students can choose an elective called Community Health. And again, that's thinking about working in our community and trying to think about, I suppose people talk about nursing in the home, and that's part of it. So how do we stop the pressure on building hospitals and all of those infrastructure that costs so much and has a huge impact on our society? So how do we think about keeping people in their own home? How do we manage that community health and health promotion as a preventative strategy? In one of our undergraduate programs, the Bachelor of Midwifery, we've introduced a subject called International Perspectives. And our idea in that subject was to think more broadly past our borders and to think about developing countries.
Going to Thailand on this experiential nursing program really opened my eyes to how diverse healthcare is. We saw a mix of the good and bad. We did visit what they call the home of HIV, which was in the middle of nowhere. They didn't have any trained staff and very limited resources, so that was really interesting to see. And then on the other side of that, we went to these fabulous private hospitals that, you know, it felt more like a, you know, airport lobby or hotel rather than a hospital. So just to see the contrast between, I guess, like the rich and the poor, yeah, it was just amazing, absolutely amazing.